Hey, thanks for tuning in. Today's video is about deadlifting for low back pain. Yes, you heard correctly, deadlifting for low back pain. Now, obviously, I'm not going to have a patient come in with acute low back pain or a spasm and start them off with this exercise. But once we get things settled down and the patient is able to move more, progressing their rehab with a kettlebell deadlift is, in my opinion, a great long-term solution for several reasons, some of which include strengthening the tissues of the low back and hips, teaching proper lifting mechanics, bracing the core, and building confidence with movement to remove fear avoidance behaviors. Now let's get into the mechanics of the lift and how I teach this movement. I want you to take a square stance with the kettlebell in between your legs. I want you to bend at the waist, so you can see I usually karate chop my waist or my hips to make sure I'm bending from my hips and not my low back, and then bend your knees accordingly to get down to the kettlebell and get a good grip on it. I want you to get some tension by starting just like the beginning part of the lift. And think about screwing your feet into the floor, so trying to point your toes out. Obviously, this isn't going to actually happen. You can see in the video that my feet stay planted where they are, but this is a good way to engage your glutes. Next, I want you to anchor your shoulders back and down. This engages your lat muscles of your back, and the idea behind this is to form an X on the back with your glutes and your lat muscle engagement. Lastly, I want you to stand up by pushing your hips forward and squeeze the glutes at the top of the movement. This is a powerful way to perform the deadlift and is protective for the low back. So if you're just starting out, start light and work your way up to a weight that you feel comfortable with and gradually continue to progress the weights, sets, and reps. All right, thanks for tuning in. Hope you have a great rest of your day.